this actually wasn't the question that I was going to ask, but the governor just put out that he has issued an amended emergency order to ensure that school systems, including private schools, have the authority to make reopening decisions, citing the Maryland Public Schools Recovery of Education Plan, which stresses flexibility. Do you guys have any initial thoughts on that?
Haven't seen it, haven't read it, haven't heard about it until you mentioned it.
Yeah, it just was posted 2 minutes ago, so I could understand that.
You're ahead of me.
What I would say, I would continue to emphasize what I stated before. It doesn't matter if we see the governor's tweet. It doesn't matter if we see the statement, because it doesn't change the fact that in the state of Maryland, the cases are increasing significantly. As County Executive mentioned, there was a time several weeks ago where we had gotten to 40 to 50 cases a day, and as a state, we were seeing 300 cases a day. That's not the reality. And you can't dismiss that. Over the weekend, there was a day where we had over 1,200 cases. This morning, there were almost 900. Yesterday, they were 900. And the reality is, reopening is premised and built upon the premise of having lower community transmission and lower daily caseloads. That is what we should be talking about. That is what should be driving the decision. If we want to talk about taking and divorcing politics from this, we would focus on the health features and the health factors. Dr. Birx, again, who is the head of the President's Task Force, has said very clearly that in order for schools to reopen safely, those principles must be demonstrated. It's very clear anyone looking at the epidemiologic data for the state of Maryland and the National Capital Region would come to the same conclusion that we have not achieved lower community transmission. In fact, the numbers are increasing. And that is what should be driving the conversation. That is what should, quite frankly, be the conversation. And we should be talking about the new studies that suggest that kids may be at increased risk. That should be the discourse. Unfortunately, that is being sidetracked, but we will continue to focus and use the medical science and the clinical data to drive the decisions that we put forward to keep the residents of this county safe.